Welcome to the Beauty of Breathing podcast, where we explore the wonders of optimal breathing. I'm Renata Nehme, a dedicated mom, entrepreneur, and myofunctional therapist committed to embodying the principles I advocate. Having recently undergone a tongue-tie release and palatal expansion, I'm thrilled to guide you through the transformative journey of embracing the beauty of breathing, effortlessly and through your nose. Let us know how much you enjoy the show by leaving us a review. Here we are. Hello, everybody, and welcome to another episode of Beauty of Breathing podcast. I have another Instagram celebrity with me today, Dr. Erick Galindo. How are you doing?
How's it going, Renata? Thank you for having me. Speaking of celebrities, we were just speaking about Josh Madsen. So I'm so excited. Look at my face. That's the way I am. I'm so excited. I mean, I cannot hide it. I'm so happy to be here as your guest, I loved your title, First Breaths to First Words. It's amazing.
It's gonna be a great talk. So you guys hang around. We are getting ready to actually go live on both of our Instagram accounts. So all of our followers can join in the conversation. You guys are welcome. If you're listening to this live, you're welcome to send us some questions as we start going through this wonderful talk we're going to have. So I'm going to go ahead while you guys are getting ready, and we're going to introduce our speaker. So the topic today is from first breaths to first words, oral restrictions, airway health, and team-based pediatric care. Presenting Dr. Erick Galindo, a pediatrician based in Guadalajara, who's redefining how we care for our children. With nearly 20 years of experience, he's turned the standard consult into something much deeper, focusing on how breathing, sleep, and oral function shape a child's development. From tethered oral tissues to airway health, to the importance of chewing and the impact of sleep on behavior. Dr. Galindo connects the dots between symptoms and root causes, bringing both precision and empathy to his practice. He's a board member of ICAP and an ambassador of the Breathe Institute. Thank you so much for accepting our invitation. We have a couple of friends in common that connected us whenever we're looking for someone in Mexico to help one of our patients. So thank you so much for being here.
Yeah, and I have a story whenever there's a chance about connection in Mexico and how, it was an adult that had myofunctional therapy and that needed a third release, and it was a complex case. And she lived an hour drive from here, and she had a myofunctional therapist from New York. But they were friends. She was doing therapy, but she was ready for another release because of 2 bad releases previously. And I connected her to Neil, the chiropractor, our friend, and because she needed his help, and then the plan was go all the way up to see Dr. Zaghi to do a perfect release, a proper release, and it ended up working so well. So speaking about connecting, and from Mexico all the way to California. So and I was an adult, but we have to act early, right?
Yeah, 100%. So this is interesting. You mentioned in the few minutes that we talked before we went live, you mentioned Dr. Zaghi. Of course, I've been working with Dr. Zaghi for a while, sending him patients. He's absolutely wonderful. We love him. You mentioned Dr. Josh Madsen, who we just interviewed for Airway Circle and for the Beauty of Breathing podcast. And you guys connected also with at Dr. Zaghi's Breathing Institute.
Yeah, exactly. I think I've texted him here and there. I mentioned he has already 3 centers, 40 plus staff, and I told him we need something like that in Mexico. I mean, if you're planning to expand, and he's just like you, he's such an entrepreneur, and I know he's gonna have some big plans all over the world, but we need him. I mean, speaking of growing healthy and finding what could be a hindrance to your development. I mean, it's such an important topic, right? And it's connected to the airway, like primitive reflexes. He was mentioning how you go from the gross motor, right? You go from the gross motor to the fine motor, and he was speaking how the tongue and the movement and all the oral functions are sort of like fine motor skills, right? And I see as a pediatrician, you mentioned right on, it was like you hit the right chord that as a pediatrician, because I'm by training as a pediatrician, like what does a pediatrician have to do with tongue ties and the socks all breathe? It's because the only way I can contribute as a pediatrician is to connect the dots.
Mhm.
I sometimes don't know how to tell the patients I know a lot about everything, and at the same time I know nothing because I see people from your specialty, Dr. Zaghi as an ENT, and orthodontists, chiropractors, craniosacral therapists. Special people that are specialized in functional neurology,
No,
and
they're
I'm
amazing, yeah.
yeah, and I'm just a general pediatrician. So, but I'm the primary care
So
physician, you know.
just a general
So
pediatrician, we need y'all's help. You know,
yeah.
you guys are the first line in front of every child out there. And I'm going to say this, the hardest professional to talk to me has been pediatricians, because you guys are so busy. You have so much going on. You're over there saving lives, you know? And we just want a
Yeah.
little bit of your time to talk to you guys about sleep. You know, let's do sleep studies as a, how can we start doing
Hmm.
sleep studies as part of screening for children, just in, you know, not in lab, but at home sleep studies, or just having simple questionnaires, because I believe that it's such an important um, pillar that is being ignored by so many medical professionals when it comes to overall health. Why do you think we're not really looking at sleep?
I think it has to do with our backgrounds, right? I mean, everybody started, as a therapist, as a pediatrician, you need to have like a life-changing event, right? It's a never-ending process of learning.
Mhm.
You have to be humble enough to say you don't know. I think this has come from Zaghi and from someone else, that you never know what you don't know, right? So
Yeah.
and you do, like Dr. Richard Baxter says, you're not ill-intentioned. You just do what you can with the information you have, right? And if you don't have that curiosity, that humbleness to say, there has to be more. And if you get rid of that mindset of just being the band-aid, just solving problems instead of going to the root cause. So to me, as a pediatrician, from personal experience, I think it's the way we are trained. And you need to have this enlightening moment, this aha moment to say, you know what? This is just not making sense anymore. Trying to medicate kids from the early stages, right, with reflux medications,
Yeah.
with trying to say, oh no, the solution for a 2-year-old to sleep better is melatonin, right?
Mhm.
Uh, and then you find there's amazing tools like the pediatric sleep questionnaire. You mentioned sleep studies. Just try to find ways to ask the right questions, right? Take the time, whenever you have the time, take a moment to ask the right questions, right? I have like screening questions that are like very focused,
Mhm.
that could like, and then you find patients, Renata, that say, "Oh, by the way, now that you mentioned, yeah, of course I see that my kid is drooling at night. I know that he wakes up thirsty, you know? Or, yeah, I have so many pictures on my phone of my firstborn. And every time I took pictures of my firstborn, when he was an infant and a baby, a little child, he was always sleeping. He was always sleeping with his mouth open, right?
Yeah.
And and then like so it starts from curiosity, and then there's so much information out there, but it's like if you start from that point and then you go down the rabbit hole, right? And you never stop. Here we are, right? We never stop learning, and patience, like being able to listen, right? Take
Mhm.
the time to listen, because patients have so many things to say. And I think it's actually, I know it's a cliche, but it's like just being with an open mind to say, what else could there be there, right? What else could there be? And
Yeah.
then I think from Josh, I could take the systems-based thinking, right? He has this pyramid. You go like everything is connected. And then moving away from the westernized way of seeing medicine, right? Renata is like everything in compartments, right?
Mhm.
This division of the human health, right? And then when you find out about fascia, this cotton candy that's connected everywhere, right?
I
And then you
love that
see,
you called it cotton candy.
yeah, I just read it from Tom Moyer's book. So I just have
I
it real
love
fresh
it.
on. Yeah, I mean, because it is actually a cotton candy, right? It's intertwined in every
Yeah.
part of your body and in every part of your cells, right? So when you have a systems-based thinking, and then you help parents connect the dots. So
Mhm.
so you narrow it down. And as a pediatrician, as a primary care physician, what I can contribute to your specialty, Renata, is like trying to make like the connections of the specialties you need. So here in Mexico, that's what I do. A patient comes nowadays, it's not only about the tongue tie, it's more about craniofacial development, right? So
Wow.
what's going on? So you have nowadays mainly my consults, first time patients are mouth breathers, right? So
Mhm.
you need to ask about the oral habits, no? And then change the mindset, Renata, because it's people here in Mexico. I know you speak Portuguese, and you see in Latin America that like the pacifier is so ubiquitous, right? It's so like, I mean, and then
It's,
it's
I
and
think
it's
it's a
all
little bit of a culture because in Brazil it's huge. I mean, I had a passy until I was 4 or 6 years old, and you see
exactly.
8-year-olds still with a pacifier in Brazil. I mean, it's not that common, but very common for a 4-year-old still to have a pacifier in their mouth all the time. It's cultural for sure.
Yeah. So, and it's not about shaming parents. It's telling them, it's okay that you didn't know. But I mean, let's find ways. Now, I'm amazed with a Nini pacifier, for example. Like you need the tongue to start working differently, and then you try to explain in simple terms. You know what the pacifier is doing is separating, creating a gap between the tongue and the floor of the mouth and the roof of the mouth. So that's and all the biofunctional valving system inside you, right? How the lips, the nose, the tongue
Hmm.
it creates this vacuum. So you try to explain parents in simple terms. If you act early, right? Acting early makes a difference because, for example, you deal with adults and it's going to take more time. It's like a marathon.
Yeah.
So, and in marathon, you hit the wall and sometimes you want to abandon the race, right?
Hmm.
So, and I think Linda Donofrio says like she likes to work better with adults because when she works with kids, it's like, okay, you did it. Now you have to do it for the rest of your life. It's like now those good habits. Now you have to do it because this is forever, right? I mean,
Yeah.
good oral habits, good posture, good sleep. And now, as you can see, and stop me whenever you can because I speak too much. I said to
Yeah.
Neil.
You're good.
Uh,
I love it. I do have a question, but keep going.
so it's about trying to find ways to act early to have a better outcome, a more impactful change,
Hmm.
and trying to feed some. In Brazil, I love it because they're trying to identify in utero, right? In
Mm.
like the malocclusions, they're trying to do ultrasounds to identify malocclusions that could cause a lot of trouble with the suck swallow breathe problems and a lot of troubles with breathing, right?
Yeah.
Mhm.
Tell everybody a little bit about that.
So, obviously we have our genetics, right? But then, as Dr. Felix Liao says, then we have epigenetics, right?
Hmm.
So you have, and then a myofunctional therapist that's pretty well known. It was a guest with Neil. It was like saying, it's going to take Renata. You mentioned you had a case yourself with pacifier use, if I understood correctly. So it's going to take like 3 to 4 generations if we want to do some epigenetic changes to
Hmm.
see that we don't have this offspring of like maybe this retrognatic small developing jaws, because it's all about the weird societies like Dr. Kevin Boyd says. The weird
Hmm.
societies are Western, educated, rich, democrat, industrialized. So with our civilization habits, we have to wait a few generations to see those changes. But to narrow to your question is, we could be more impactful if since the ultrasound, we could see a child that's already maybe sucking their thumb, because we know from early start, from the first trimester, there's already development of swallowing movements, right? So if we can identify early, like again in Brazil with the tongue tie identification protocol that they established in 2014. So if you see that you have any changes, you could start using some kind of oral motor therapy to promote, because what I'm trying to explain is like form follows function, right? So if you act early, and that's why us pediatricians here in Mexico, we are the ones that are present at the birthing event.
Yes.
So if you're able to identify, movement of the whole body, like a physical therapist says, do a lot of tummy time, extension of the neck, that's all these things. The fascia acts early. Like Josh says, the autonomic nervous system from the polyvagal theory.
Yeah.
So starting early, so you're able to see how in the first 12 months to 24 months of life, you see how the face starts developing differently, right? And that's kind of like a conservative intervention. And you see better breathers, better regulation of the nervous system, because now we know how it's connected, right? And then you have kids, you cannot imagine how long. I told Neil, I don't know how long it has been that I have not given medicine for colic,
Oh my goodness, hearing this from a pediatrician, it's crazy. But
Yeah.
how? What inspired you to shift from traditional pediatric care to a more integrative approach focused on breathing, oral function, and sleep?
I mean, long story short, everything started with tongue ties. And shout out to my mentors, Dr. Richard Baxter, Dr. Zaghi. I know another cliche, but I do stand on the shoulders of giants. And first it was tongue ties, oral restrictions, and then eventually you're gonna see that it's not enough, And then so that was one part of the story, and the other one, Renata, is like, kids were not improving. I mean, it as a pediatrician with my medicalization, like all medicine-based treatment band-aid approach, kids were not improving. So we're not getting better, and parents were all over-informed because of social media, and
Yeah.
they were not finding the answers. And then I think I got motivated because when I connected, I mean, now my right hand is a physiotherapist. Every time a baby comes to see me, they have to go to see a physiotherapist. I even do early interventions, and I go to the nursery and I take with me a physiotherapist to check for primitive reflexes, the swallow breathe pattern, the need of a Nini pacifier. And then what I found out, the combination of physio, osteopathy, which shout out to Brazil, which is amazing, the osteopathic school in Brazil. And then me as a pediatrician just being like the guide, and everything started working perfectly. I
Wow.
told Neo those stories. So that's why I got into this. And like I told Gigi Tadros, now this lens, it's hard for me to see it differently. I mean, you have to stay with your open mind because
Yeah.
I mean, we're so biased, right, with our confirmations. But I mean, be aware that there's more to know always. But that's a story of what
Yeah.
brought me to this space. Yeah.
That's incredible. And then you mentioned Dr. Neo Bukandani. He's an incredible chiropractor in the
Yes.
West Coast. He's treated me before, and oh my gosh, you just melt on his hands. He is
Exactly.
incredible. And he introduced us. So thank you, Dr. Neo. He's over here listening. And you
Yes,
mentioned
thank you,
Gigi.
Neil.
I just sent her a patient yesterday. So it's crazy how all of us are connected in such a way and with the same mission,
Yeah.
What is it that one of my mentors says? Something about, there's no competition if we're all going in the same direction. It doesn't matter.
Exactly.
All of us are going to be in different levels of our careers, even if we're in the same specialty. But if we're all going into the same direction, which is to help more patients find the root cause of symptoms and be healthier, we are all in this together. So I love the
Exactly.
collaboration approach. How did
Yes.
your early clinical experience with unresolved symptoms in children shape your current philosophy on pediatric care? You mentioned you started with tongue ties. What was it that you were seeing that you started thinking maybe the tongue restriction may be an issue?
Well, it was as a pediatrician, I do believe I am to the heart a promoter of breastfeeding. So initially, I was like already not very happy with the pharmaceutical companies sponsoring physicians to go to the conferences, So it all started, and then with my own kids that we
Mhm.
didn't have, and my 14-year-old, and I have a big pass right there. He has a tongue tie. He cannot. So it's always personal, right?
Yeah.
So I mean, breastfeeding was not working. And on IBCLC, who's amazing over here, she's kind of like my partner in all these cases. And she mentioned, you know what? Do you know about tongue ties? A friend of my dad, who's a pediatric surgeon, told me how to do the scissor release. And initially, I didn't know a thing.
Mhm.
We very accepting to be criticized by Dr. Gahary that I was just doing just a small snip, of the tongue with the scissors, and things were not improving. And then I discovered this world from therapists. I mean, the connection from pediatric general care and physical therapy. I don't know. You're gonna listen to me so many times say physical therapy because the body, the way you do as a any kind of, I don't know if it's the right word, but it's so many times mentioned that in the States, the body workers.
Mm.
I mean, the CSTs, the OTs, everybody, even the myofunctional therapist, because
Mhm.
like it's not only about from the eyebrows to the base of the neck, right?
The
It's
whole
all
body.
connected. So I think, I mean, finding ways that kids got better, again, as I said.
Mhm.
And you mentioned about collaborative work, right? I mean, if we focus on patients, on parents,
Mhm.
which are looking for answers and not getting them. And I don't know if it's modernity, but you cannot see patients by yourself because the cases are too complex, right?
Yeah.
And you find out that if you work together and you connect people to many specialties, you see better results, right?
Mhm.
So, and then it as a specialist, if you only do the quick fix of a frenuloplasty and you don't do the habilitation or the prep
Mhm.
the prep work, and if you don't do the follow-up, you're going to end up not getting any results, not better breathing, not better functional patterns of the mouth, right? Not better swallowing, a lot of compensations that decompensate many other things, right? So we need each other.
Yeah.
So otherwise, I don't see myself working on my own with all these complex cases. I mean, nowadays you need an allergist because I mean, I live in
Mhm.
a 6 million people in the metro area here in
Mhm.
Guadalajara. Can you imagine pollution here?
Yeah, I
And I
mean,
know, yeah, cheers to your mate that you're drinking and my
I
coffee.
am
And
drinking yerba mate.
yeah. And so and then and all the mold inflammation, chronic inflammation, so many
That's a
things
big issue.
environmental, right? As as
Mhm.
a as a specialist in your case, you see a lot of people having environmental issues, right? You
A
see
lot over
chronic.
here where I am in
Mhm.
Georgia. Whenever you arrive and you're landing with the plane, at this time of the year, you just see yellow. There's so much pollen. Over here, the biggest issue is definitely allergy to pollen. It is insane. My all my furniture outside, everything is yellow. The car is everything's yellow. It's kind of
Yeah.
crazy how intense it is, the pollen over here.
Yeah, and then like Dr. Zaki said December on our update at the Breathe Institute, it's seeing beyond the airways as well because so many things could influence. Uh, I mean, I love his phrase that it's breathing is the beginning, but
Yes.
then you see what the factors are that could be influencing negatively your bad breathing, right?
Mm-hmm.
From the start. Formula usage, bottle drinking, pacifier, not movement, the compartment syndrome that Dr. Gigi mentions. Kids are all the time on their strollers. They're not moving enough. So you, and then there's a connection, like a lifelong connection of things you can do, like interventions. So if you find all
Mhm.
these connections and you see there's no quick fix, and you encourage parents to keep looking for improvements, and it's here and there. We're not perfect,
Mhm.
it's
Of
here and
course.
there, bit by bit. So parents can endure, right? Because if you tell them, oh no, there's going to be this long term, and you invade them with all this information, it's overwhelming. So
Mhm.
you want parents to keep up, right? Mhm.
100%. And what are some symptoms for parents listening? What are some symptoms that you're looking for when a new baby comes in terms of maybe could be tongue tie or lip tie? What are you looking for?
I like from the basics that I've learned from physiotherapists. You try to look for tensions, right? So, and then also from Josh, you try to look for the basic knowledge of primitive reflexes, right? The grasp, the movement of the neck, all this asymmetrical tone, neck reflexes, the basic reflexes, right? The Babinski. So you try to look for neurological stability, right? And then you try to and also a big mentor, Nancy Galamusa, she told me the importance of the sock swallow breathe pattern. So you
Hmm.
try to see the breathing pattern in a baby. I mean, from even just using your eyes to see, so you put your finger, you try to see you see an actual breastfeeding moment. So for parents, you could see the positioning of the baby.
Hmm.
If the baby has a lip seal, you can teach them the resting position of the tongue, right?
Hmm.
You can tell them, it's important for the baby to move its neck from side to side. Unfortunately, here in Mexico, we have a high rate of C-sections, right?
Super
So
true.
and from physiotherapists that already having a C-section, it's a flag that you have to understand that the kid was not having maybe the best proprioception, right? The
Hmm.
best movement activity in the womb. So you try to see, a C-section, it's not a shame. It's fine. It was a decision, but we have to be more aware of baby's posture, baby's tongue position. Let's do an evaluation of a sock swallow breathe. Let's find you as soon as possible a consult with an IBCLC. And that's what I tell parents. So my dream team as a pediatrician is okay, you come first week and I tell you, okay, let's do an evaluation of the sock swallow breathe. Tell me about breastfeeding. Tell me a little bit about sleep. Let's see movements. Let's see those primitive reflexes. Let's look for neck tensions,
Hmm.
right? Let's look maybe from already 1 month. Now I've seen kids 1 month and
Wow.
already having plagiocephaly. And that's a big sign, or kids that are every time they're feeding, or you do the right questions like feeding and they have just the fists all
My son.
tense, you
Hmm.
know?
Always, my
And that,
son always had his hands like this.
yeah. And then you see the feet already curled down like this, like grasping. And
Hmm.
that's a sign according to what I've learned. So you try to look for tensions, right? And then so you take time to explain parents. That's what I would say as my answer. That's what I could tell parents. So and then sometimes parents are not aware that it's not okay to have your not a appropriate a proper lip seal, right?
Hmm.
So I tell parents, the baby and lift this chin as many times a day as possible, and then lower the chin again and look at the tongue. And it was
Hmm.
amazing. I didn't know that. And it's
Hmm.
and that helps babies self-regulate, right?
Yes, I have
And
a video of Benny when he was asleep, and I showed these on my talks. I
mhm,
just spoke this weekend in Seattle at the PNDC, which is a huge
uh-huh.
dental conference. It's funny because when they invited me, I was so busy, and I was like, "Yeah, sure, I'll come." And I thought it was a study club. I got there; it's a 4,000 people conference. I had four
Yeah.
lectures in one day, and two of them were sold out. So I was super, super,
Wow.
super excited. And I show one video in one of these talks, and it's of Benny whenever he was asleep. And I show exactly where you should push underneath the chin whenever, if
Hmm.
there's their mouth open. So you're not
Hmm.
necessarily pushing the chin, you're pushing the tongue underneath. So you have to see where the
Yeah.
tongue is right underneath here. And then you push and you hold lightly. You just press on it gently and you wait for the child to swallow. As soon as they swallow, you can let go because the tongue stays up there and the lips stay closed.
Yeah, and you see, and when you try to do it like repetitively, you see
Mm-hmm.
how, I mean, you see even how babies relax, you know? It's like,
Yeah.
and learning the complexity of the tongue as well, right? All the cranial nerves and all the muscles that connect to it, and then again, the floor of the mouth, right? And all the connections with like the muscle chains that you see all the way to the shoulder grid and to the scapula, to the back of your yeah, to the top of your back.
Mm-hmm.
So, and it goes all down to your spine. So, and then you learn to see those things. And as a pediatrician, again, just being able to identify, you know what, I think I see something. Let's go ahead and find out. And then
Mm-hmm.
you ask the question, did you see that your baby is like colicky? It's like a little bit like already like clenching itself, like bending its knees, and it's not breathing appropriately, you know? So all those things that I find, and to me the most humbling thing is like
Mm-hmm.
even you cannot imagine how I don't do as many tongue-tied releases in babies as I thought I was gonna do,
Mm-hmm.
according to the teachings of Dr. Baxter. I thought I was gonna be like,
Mm-hmm.
yeah, Dr. Tongue Tie here in Mexico, and no, because there's so many prep work, right? I mean,
Yes.
so many things that have to go beforehand. And I'm not saying we don't need to do tongue-tie releases, and sometimes it gets so political, right? So
Mm-hmm.
divisive. But if you find like there's work to be done beforehand, and that gives reassurance to parents, right?
Mm-hmm.
And then they don't feel the pressure and the stress
True.
that it's all about a surgery. It's more than that, right?
100%. You mentioned a little bit colic. What do pediatricians learn about colic, and how do you see it different now?
I thought before that colic was something that was like the rule of threes, right? It was 3 hours a day, first 3 weeks of life up until 3 months. And it was like no explanation. We don't know what's going on there.
Mhm.
It's mostly gastrointestinal, and it will go away. And it was just this I mean, this conformity of saying uh, it's normal. And I always like criticize myself that for pediatricians or physicians, if you see a pediatrician saying to a parent it's normal, maybe it's a meaning I
I
don't
don't
know.
know. All of
But
us.
I don't know, but I'm too ashamed to say. And let's see, and maybe it will fade away, and let's just wait on it. And
Mhm.
then you have sleepless nights, and nothing solves it. And then you feel that you are doing good because you're prescribing gripe water instead of Millicon. And it's like, oh no, now I'm a naturopathic physician, and all good. And I mean, I cannot be criticized anymore. And then you see, well, but what's beyond that? I mean, what's going
Mhm.
on? And then you find out about the vagal nerve, right? And you find about the
Mm.
and then all about the Vegas. I mean, I am so, it blows my mind, everything that's behind that cranial nerve.
Mhm.
So, and then you find the connection with breathing and the digestive system and the parasympathetic nervous system. And you see, oh, now I see there's that connection I was not willing to study. I was not willing to go to my physiology 101 when I was in med school, and now it becomes so handy. And and the connection with the body, right? So what
Yeah.
clicked to me, Renata, is like, again, I mean, I've said it 3 times, but I mean, body work. You take a colicky baby to a CST, and
Mhm.
they work on the dura, they release all the tension, how
Mhm.
the fascia is connected to the digestive system. You help babies regulate their nervous system, their respiratory rate, all those things, and you have the heart rate variability, and all those things get regulated, and then all of a sudden the baby's not colicky anymore, you
Oh
know?
my goodness.
And then,
If
and you
I had
find the tension.
known,
Yeah,
my
if I had known. Yeah,
my
and it's
10-year
not
old
only a tongue tie. Yes, and it's not
Zoe,
only
when
a
she was
tongue tie, right?
first born, oh my Lord. She had lip tie,
Yeah.
tongue tie. 2 IBCLCs checked her. They both said there was no ties. And Zoe would start crying every night at 9 p.m. and go sometimes until 1 a.m. for 6 months. I thought I was going crazy. And my mom just kept going. My mom lived here for 6 months to help me. And she just kept going, Renata, she's hungry. Just give her formula. And I would look and I'm like, no, but I have milk. Like, I don't understand. This can't be it.
Uh-huh.
And 2 or 3 times, Zoe, as a little tiny, tiny newborn, she choked on milk where it would come out of her nose, but she would turn purple and just stop breathing. And I had to suck stuff out of her nose for her to be able to breathe again, turn her upside down. I mean, we've done a few things, and those are all signs that I had no idea. I had no idea that they were all related. I had recently found a photo of her sleeping right on top of me, but with her mouth wide open and her tongue low. I had no idea. And even though I learned all these things before I had my second one, Benny, I still miss his lip tie. Isn't it crazy knowing what I know? I still miss his lip tie. So that's where the whole team is so crucial for you to be able to better treat these kids, these patients, because it's so complex. And I do believe that moms are blind to their own children's issues. You have to have a set of, a different set of eyes to look at them to be able to help you.
Yeah.
And going from colic, let's talk a little bit about tonsils and adenoids.
Yeah.
We all know how much of a huge talk this is. Most of our patients, of course, I'm a mom before I'm a therapist. We do not want to go through surgery first. I know that there's a couple different ways that they can either just shave them down or they can remove them completely. As a pediatrician, what has been your experience in evaluating tonsils and adenoids? When do you feel the need to send to an ENT? What are your usual recommendations to a parent of a child with enlarged tonsils or adenoids?
Back in 2002, right? From studies, and again, shout out to the giants like Dr. Guilleminolt and Audrey Yoon and all those specialists, right? So, and shout out to orthodontists. I mean, as a pediatrician in 2002, I think it was like, you have sleep issues, you have enlarged adenoids and tonsils, go to an ENT, remove them, and you're done with it. And then Dr. Guilleminolt and people like from his specialty and all those amazing people and researchers, they started to find out that was not enough. And
Mm-hmm.
then we're trying to discover all these craniofacial anomalies, right? Malformations and like the reduction of space. So as a pediatrician, that's also another thing, Renata, that has changed to me. And I remember, like, my dad is a pediatrician. I've been a pediatrician for almost 20 years, and I just have it so freshly in my mind. 10, 15 years ago, like, let's just wait it out. When your child turns 6, he'll be fine. Now he has like a lot of ear infections, sinusitis. Let's give him 21 days of antibiotics, and the symptoms will resolve themselves, and just wait it out. And eventually, I mean, as a pediatrician, I'm trying to save you from surgery. I'm so good at this. I'm telling you to wait until 6 years old. And forget about asking sleep questions. It was
Mm-hmm.
like all the meds, all the antibiotics, all the steroids, like prednisone, and let's see what happens. And then all of a sudden, it was like, yeah, what about maxillary narrowing? What about the top of the mouth is the base of the nose? What about that structure? What about your basic anatomy, Dr. Erick? It was like, like, oh no. Now, so to me as a pediatrician, I mean, honestly, to me, a lot of kids come as mouth breathers. So now you have me measuring the intermolar diameter, doing TR, asking and ordering CBCTs, scans of the airways,
I
a
love
different
that.
a different approach. And then it's like,
Mm-hmm.
yeah, act early. I like Airway Circle. I think it's another podcast, and they have another podcast is or Airway Foundation. I'm sorry, and they
Mm-hmm.
say I like the model that says fix before 6.
Yes.
6, and so the earlier the better. So as a pediatrician, I tell parents, I mean, yes, I know some large adenoids are all the way an indication for surgery, but you need, I mean, they're neighbors, the orthodontist and the ENT, they're neighbors. I mean, they live close by. I mean,
And they don't talk.
The ceiling of my office is just like the floor of my office on top, and they're like, just be like, this is the mouth, and on top that's the nose. I mean, I think you need to talk to each other, so I mean, there's a collaboration as well. I tell them, yeah, you need to go to see an ENT, but your child is already 3, so he could be scanned with a CBCT, and let's see what the orthodontist has to say, because I see there's some narrowing of the maxilla, and like we have to do that early expansion to make a better breathing. And sometimes it could be no need for surgery. That's what I could tell you about enlarged tonsils and adenoids.
Do
We
you
have
make
to
any
see it
other
from different lens.
do you make any other recommendations as far as diet or allergens?
Yes. And now it's that nasal hygiene, right? A nasal sprays, high pressure, low volume sprays. And when you have sinusitis, I tell patients you have to do high volume, low pressure, like sinus rings. And it like, that's to me, that's very clear, right? And so you have like just nasal, usually and now people say dentist, right? Nasal hygiene has to be like mouth, like your teeth hygiene. And I posted a story and it was funny, and I think I got a pretty good traction. It was like, if your kid doesn't want to brush his teeth, rinse his nose. So the mouth is going to stay closed, and if you don't give ultra processed foods,
Yes.
you have lip seal, and the saliva is acting as it should. If we were like before the agricultural revolution, we didn't have toothpaste. It was all our saliva and our chewing, And I like to think in evolutionary terms, So I tell nasal rinses, it's so important, nasal rinses, and because of pollution and pollen and dust and mold. So nasal rinses every night. And also diet, we know dairy, it's kind of inflammatory, And overall, you see people that have chronic inflammation. And so I usually do high dosage of vitamin D. Yeah.
Amazing.
DHA. So my package of my immune package, as I say it, Renata, is probiotics, vitamin D, omega-3, and then nasal rinses. And then I do go through with families. I go through environment. Here at my office, I have a HEPA filter. So I do, and then like Dr. Zaghi mentions, like your dehumidifier, right? 55% humidity. Go on Amazon, buy a measurer of humidity. So you go environmental, you go diet, you go basic nasal rinses, and sometimes you do a little bit of steroids, but you see overall. And then kudos to you all. Like let's see about your chewing, let's see about your swallowing, let's see about your breathing, let's see about your oral habits, let's see posture, right? And I think that's my contribution to families, to tell them how to walk that path.
Amazing. All right, we're getting to the end of our meeting today, but I have 2 last questions. One of them is, what would you recommend for everyone listening out there, patients and myofunctional therapists alike? What would you recommend a better way for us to approach our pediatricians?
Wow. I don't know why. Yeah, I listen to you guys, and they tell me in the States, you cannot imagine how hard it is for us to talk to pediatricians. I think advocacy. Find one pediatrician that can spread the word. That could be one, and I think the culture there in the States, a lot of meet and greet, a lot of social, like, let's connect, let's have a like, that's the way of spreading the word. I would say we need to broaden our learning. So if I go 3 years back in time, I would love to have something like the 101 of Mayo, something basic. I think you've already done it, but it's like I would say two things to make my question to be on point.
Mm-hmm.
I think find one pediatrician that's on your side, and that could be a good advocate to keep spreading the word. And the other one is keep working on the importance of the team-based approach.
Mm-hmm.
Uh, and also, I think through parents. Parents, I mean, help. I mean, if parents tell their stories, pediatricians listen to their parents,
Mm.
and so if parents tell you as a pediatrician, you know what, I went to Renata and my kid is breathing, sleeping better, those antibiotics for the otitis media that was so
Mm-hmm.
recurrent, I mean, because of the function of the tongue and the position of the muscles, everything's getting better. So that's
There
what I
you
would
go.
answer for you
And if
guys.
there's any parent listening to this who has had improvement, on their child breathing, sleep, with myofunctional therapy, with orthodontics, with any airway specialist. I think it's called Airway Revolution. My friends over there, they're collecting stories.
Oh,
So yes, they're collecting stories. So if you'd like to share your story, I know a lot of our parents do not want to share photos, do not want to share anything. But if you know how many other lives you would be saving by sharing yours, I really would ask you to think kindly to be able to let
yeah,
us share your stories. And then the last question that I have is, and I'm going to share first, and then you can share. What
yeah.
is one thing that you would tell young parents? One thing you tell young parents that you wish you knew whenever you had your little ones. For me, actually, there's two. One, I usually tell girls that are pregnant that I used to meet whenever I was cleaning their teeth. Go ahead and have an appointment with an IBCLC, an international
Mhm.
board certified lactation consultant, before you have a baby, if you're wanting to breastfeed, because breastfeeding is so difficult. It is a learned skill, and for you to have all the information before you even, the challenges arise, if you already know what to do if they come, it'll be a lot better, because after you have your baby, hormones are high and you're stressed and you're exhausted, and it's a lot easier if you already have, a phone number that you can call and somebody to help you, and you already know what to do. And then the second thing that I'm going to share is, I wish I knew how important movement and massage is for little ones. Like, I totally just want to have another baby just so I can massage the heck out of them all the time. So to help them move and to help them, with the growth and development. If I had any idea how important it was, I would have done it all over. But your turn.
Yeah. My turn. You beat me to it. But I was gonna say movement. I am impressed how much lack of awareness is to the importance of the body connections through movement. So my recommendation to a young parent is do body work on yourself,
Mhm.
and we are so interconnected as human beings and nervous systems. So my recommendation is I would treat you with a gift card for both of you as a couple. Go to an osteopath or a
Wow.
chiropractor or a body
Yes.
worker and do some body work yourselves.
Mhm.
And as a pregnant future mom to be, I will do a lot of body work during.
Mhm.
And here's another gift card to you as soon as your baby's born, even if it was a vaginal delivery. Go and have a CST session
Yeah.
and or have it along with your baby. I've seen so many cases like Lori Hendrickson that does work with moms and children with their infants at the same time. And you see just like you melt like butter and it's so you breathe better, your mood
Mhm.
changes, you even poop better,
Yes.
You are
All of your
so
systems are affected. Number one, by your breathing, and then everything is just a cascade.
yeah, so breathing and body work. That's what I would say. That's what I would
Yay!
tell parents. Yeah, breathing
I
is so
love it.
important. Again, we end up saying breathing. I love that from Dr. Zaki because breathing is a beginning, you know?
Yes.
I love that.
I always say it's the
Yeah.
first thing you do when you're born is the last thing you do before you die. If breathing is
Yeah.
affected, it's going to affect every single system in your body. So breathing is
Yeah.
always number one. If you're a mom and you have a child who has enlarged tonsils and adenoids, and you're trying to do myofunctional therapy, you're trying to do any of these habit correctors, it is not going to work. You have to address breathing first. We know that we
Yeah.
don't want to do surgery first. However, are you willing to stop all sugar, all dairy, all processed foods, maybe gluten? We have to try and see what are the things that could be affecting your child.
Yeah.
But there are answers out there. We don't know yet exactly 100% of what causes enlarged tonsils and adenoids, but we know that these things can make them worse. So, of course, mouth breathing does not enlarge them, but it does make them worse. Anyways, this has been such a wonderful talk. How can people find you? Share with everyone your Instagram, your incredible Instagram account, and your
Yeah.
practice. What else do you have? Do you have courses or a book? Or go ahead.
I was thinking about you guys, like you people, like you do a lot of things to spread the word, and you're like such a big entrepreneur, and like I don't know how you do it, but yeah, I need to work on my courses. I don't have any courses yet.
Let's do
I
it.
mean, yeah, I need a course. There's a lot. We need to like 2 seconds. We need to like homogenize knowledge. I mean, here in Mexico, we have so many disparities. So we have a lot of general physicians that don't even know. I mean, like, forget about pediatricians, physicians
Mm-hmm.
overall. So we need to do our social service, like, so thinking about a course for general physicians. So I need to do my course. I need to work on my podcast. But for now, to answer your question, just find me on Instagram, Dr. Erick.Pediatra. That's where I post the most. I also have a TikTok account. That's not that very active, but Instagram is where I connect with the right people, such as
Yeah.
yourself. And yeah, I think that's my go-to place, Instagram. It's been a blessing.
Amazing. Yes.
Look where I am. Thanks to that.
Yes,
So
and since you
yeah.
mentioned that on Airway Circle, we do have a course that I made for anybody who wants to get their feet wet. It's called Intro to Airway, and we have 14 different speakers. Some of the best speakers in the world are a part of that course, and I have it tucked in, and I didn't really promote it at all. So if anybody is interested in taking Intro to Airway, you can email me at Renata
Right.
at airwaycircle.com, and I'll give you a link for it. But it's a
Yeah.
wonderful, wonderful course. We talk about breastfeeding, about muscle movement, about physical therapy and airway, myofunctional therapy, sleep. We talk about everything. It's an incredible course.
I need to take that course. That sounds amazing. Yeah. So I need to get my feet wet. Yeah, a little bit more. Yeah. Thank
Uh,
you for this. It was an amazing time, a great conversation. And yeah, here's for keep connecting in the future, right?
Thank you guys so much. And this Thursday, don't forget this Thursday on Airway Circle, we have Dr. Stanley Liu, who is an incredible surgeon, sleep surgeon. So hope to see everybody there. Thank you so much, Dr. Erick. You have a wonderful day.
Yeah, likewise. Thank you, everybody. Have a good one. Bye.
Bye-bye. Thank you for joining us on another insightful episode of the Beauty of Breathing podcast. Make sure to join the conversation on our Instagram page, Myo Moves, and continue exploring the fascinating world of airway health with us. Until next time, let's breathe deeper, live fuller, and discover the beauty in each breath. Quick disclaimer: the Beauty of Breathing podcast has been produced for entertainment, educational, and informational purposes only. All of the content, views, and opinions shared by our hosts and guests should not be a substitute for medical advice. Please consult with your healthcare professional for any medical questions.